Okay, guys. So, good evening, and sorry for the delay, and I'm so sorry for the last 2 days. Also, I couldn't, take the class. So, but no worries. Today, I'm here to take your class, and today we are going to discuss the things. Okay, today we are going to discuss the things. So, today I'm teaching you from the iPad, so you'll not be able to definitely look at me, but my voice, you can tell me if it is audible or not properly. Yes, guys, if it is audible or not, please tell me.
Yes.
Great. Okay, great, guys. Thank you very much. So now we can start the class, and today, uh, you know, one more very important thing is, let me just so one more thing is there. I think I will not be able to see your comments. Otherwise, I have to come again and again. Anyways, let me share the screen, guys. Let me share the screen, then we'll see how it goes. Okay. And why I'm teaching you through this? Because today we are going out of the box. Let me announce one more thing, guys, for you. See, I couldn't take your classes for 2 days. I couldn't take your classes for last 2 days, and this is a very important class on public health and epidemiology. And today's class was supposed to happen on study designs. That I'll take later. That's not a big deal for me. I can take it anytime, guys. I can take it anytime. But today I am going to take some other topic. Okay, today I am going to take some other topic. Can you guys guess what I'm going to teach you today? Yes, anyone? This is out of the syllabus topic today, what I'm going to teach you. Can someone guess what I'm going to teach you? That is from the public health and epidemiology only. Yes, people, can you guess what I'm going to teach today? Any guess? Any guesses from public health, pharmacoepidemiology, and all? The part of pharmacology, I mean, part of public health and epidemiology only. Yes, people, any guess? Just give a wild guess, whatever comes in your mind. Yes. No, no guesses. Okay, fine. Then let me come to the point directly. Let me come to the point directly. So today, today we are we are going to talk about we are going to talk about health economics. Okay. Today we are going to talk about health economics. This is one of the interesting topic, and I thought I should definitely involve this topic, and I should take at least two classes on health economics for you. Two small classes for you, so you can understand this topic also. See, I could have come up with another course in on health economics, but no, I really wanted this to include for you. So along with the basic epidemiology and public health, you should get something which is really good and interesting for you. Okay, which is really good and interesting for all of you. Okay, so let me start with something, questions, as I always do. Right, let me start with some questions. Like, my first question to all of you is, what is the exact role, what is the exact role, or what is the exactly or primary concern of health economics? Why we want to learn health economics? Why we need health economics, guys? Yes, today no options. Today no options. I just want to know what are the primary concerns, or why we need to study the health economics. Yes, tell me. Fund management. Fund management for cost effectiveness of medicines. How?
The
Little more.
uh,
Yeah,
pa- the life of the patient which is going in this illness, and thereby how it affects the production or economics of the country.
you are telling quality of life.
Yes, quality of life.
Quality of life. Okay. Cost of treatment. Is it cost of treatment? Okay. Policy making, affordability, estimating the cost effectiveness. Okay. Anything else? Anyone else who wants to comment on this? So let me tell you. Let me tell you why exactly we, need health economics. Why exactly we need health economics? So there are multiple things, but the best answer could be we have to efficiently we have to efficiently allocate the healthcare resources. Okay, healthcare resources. Best allocation of healthcare resources is health economics. And resources could be anything, either in the monetary basis, or efficacy of the drug, quality of life or adjusted quality of life of the patient, or
Mm.
anything. It could be anything. Okay, so we usually here in the branch of health economics, we usually work on the efficient allocation of resources in healthcare. Okay, we work on efficient allocation of healthcare resources, and how it works is how resources are produced. Usually it is how resources are produced, distributed, and used. Okay, how distributed and consumed, right? So there are three things: consumed, production after production, how they are distributing, and how these things are being consumed. Okay, and keeping only one thing in mind, that is cost. Keeping only one thing in mind, that is cost. And along with that, nowadays they have added multiple things like sustainability and all also. Okay, sustainability also is one of the major term now what they use in health economics, but usually they work on the cost of that. So let me tell you, as we were talking about, what are the exact scope of health economics. What are the exact scope of health economics? Can someone tell me what are the scopes of health economics? You think you were telling something, but not exactly those. But let me tell you something. Tell you something more about that. First thing is, as we told, the guys, focus now. Now it is, here I need your focus. First thing is resource allocation. Resource allocation, as I just told you, right? Resource allocation. What is resource allocation? Resource allocation is how to distribute the limited healthcare resources optimally, right? How to distribute limited healthcare resources optimally, so with the best use, right? With the best use. Resource allocation means either those are funds, those are the drugs, those are the healthcare supplies, or for an example, in the COVID, those were the masks and PPE kits and the food, or whatever healthcare related allocations, healthcare resources, or maybe the oxygen cylinders were there, or maybe the new type of ICUs or ICU setups or beds were there, which were distributed all over the world, all over the India and all over the world. So how to do these things efficiently, and how to work most efficient with the limited resources, with the limited resources. That is the first thing what healthcare economics teaches. Second thing the health economics teaches is cost effectiveness, right? So how we will learn the cost effectiveness is one of the important thing for the public also, for the healthcare also, for the government also, because as I think last time also I told you the example of someone else, the Ayushman Bharat, right? Ayushman Bharat, right? Ayushman Bharat is there. So here all the funds are going from the government, all the funds are going from the government, and government has to find the most eligible people for that. Most eligible people means who are actually needy, right? Who are actually needy. So these resources are being utilized by the people who are in actual need, that is also an example of cost effectiveness, right? And then another thing is like, what are the actual treatment cost is coming, what is the actual diagnostic cost is coming, like the treatment costs are how high in the government hospitals, how high in the private hospitals. They manage everything, they try to manage how it is being delivered to the public, the treatment costs, then the diagnostic costs, right? So I'll not go into these things, I will come to the major point later, but I'm just telling what is the scope of health economics, and how you should study and what exactly you have to study in the health economics. Diagnostics are there, and then the public health programs are there, right? Public health programs are there. So these all things are are must be there for the cost effectiveness, and these programs would be there for the cost effectiveness. We work on these things. Suppose I'll give you an example here in the cost effectiveness. Suppose, see, one drug is prepared. Let me write here so you'll understand. The drug A, okay, drug A. Sorry. Yeah. So the drug A, the cost of drug A is actually 10 rupees. Okay, like 10 strips of the tablet. 10 strips of the tablet is 10 rupees. Okay, 10 tablets, 10 rupees, right? And the side effect profile, induced hospitalization is 20% after taking this drug. Guys, try to understand, this is a very serious thing and very important example I'm giving you here. Drug A is costing 10 rupees and the side effect profile is 20% hospitalization. Okay, and one hospital cost is around 2000 rupees. Suppose, just I'm telling you, 2000 rupees per admission. 20%, I'm not telling 20 admissions, 20% of the people who are getting this drug because of the side effect, they get admitted, and per admission cost is 2000 INR. Another drug is drug B. Okay, drug B is there. It costs 25 RS to the public. Okay, it costs 25 RS for 10 tablets again, and the side effect profile is just 2% hospitalization, and definitely hospitalization cost is 2000 rupees. Okay, 2000 rupees. So can you tell me which drug is cost effective here? Which drug is cost effective here? Can you tell me, guys? Yes, which drug is cost effective here? Drug B, definitely drug B. Okay, yes, definitely this is drug B. And how they, how we usually check, how we actually check the effectiveness is by multiple means. There are the formulas, there are the methods, those I am going to tell you. That is very important to understand in health economics. Okay, so this is cost effectiveness because the maybe the initial cost of the drug is cheap to the user or to the consumer, like the patients, but the end result will be costing them very very high. Okay, and it will be a burden on the society, right? So when you are looking at the drug cost initially, it is very easy to find out, okay, drug A is perfect. But at the end, when the actual outcome comes, then you will see that expenses related to the side effect of 10 rupees tablet, I mean 1 rupee tablet, is quite higher. Okay, quite higher. So that's why these health economics come into the picture, and based on that they assess every scenario: future, past, present, development of the drug, distribution of the drug, post marketing surveillances, side effects, and based on that only they define the cost, and they say which is cost effective and which is not. So cost effectiveness is not only told or decided by only one price. Okay, this is not decided by only one price of the drug, right? So here first is resource allocation, then the cost effectiveness, then the third important thing what you will see is health policies, right? Health policy making, right? So governments are involved, federal governments are involved in policy making, right? Federal governments are involved in the policy making, and like our ICMR is government, or Ministry of family and health welfare, family welfare is involved, right? Health and family welfare is involved, and or DCGI is involved in the clinical trials and policy making for the post marketing and the drug clinical trials and all, right? And in other different countries there are different policy makers, and so, and WHO is there, World Health Organization, for the policy making. So this is very important because the healthcare policies are made after, guys, you will be surprised, and very important thing, you will be surprised that these decisions are being taken after multiple things: cost of the drug, cost of not only the cost of selling, cost of manufacturing, supply, use, utilization, availability, and weighing costs, benefits. Okay, benefits, and then the social impacts. There are societal impacts. There are multiple things which have been checked, and based on that analysis, the health policies are being made. Like based on that only the health policies are being made, and health policies talk about how to utilize the resources, how to reach the people, whom to reach, how to reach, where to reach, and what to give, right? So health policy is made after the health economics only. So health economics is one of the important and integral part of healthcare policies also. And then the fourth important thing comes is the healthcare system, right? So healthcare system means what? Healthcare system, if I tell you, healthcare system is nothing but you know analyzing the fundings, or the structure, or the functioning of what? Of either those are private or public healthcare system. Healthcare system means hospitals. Healthcare system means hospitals. So they have all the things, like in the healthcare system they have to manage that. They have to manage based on the healthcare economics. They have to manage the entire thing, right? After analyzing all the functioning, all the fundings, all the structure of healthcare system, whether those are private, public, or hybrid level, right? And then definitely pharmacoeconomics, one of the integral part of integral part of health economics. Pharmacoeconomics, right? Pharmacoeconomics, how many people know the pharmacoeconomics? Can someone tell me what is pharmacoeconomics? Yes, guys, pharmacoeconomics. Yes, pharmacoeconomics. Yes, guys, pharmacoeconomics, tell me. Only one person has told no. What is pharmacoeconomics, guys? Come on, tell me, what is pharmacoeconomics? There are 86 people. Cost of medicine. See, okay, looking into the economical aspect of pharmaceuticals and healthcare system. Okay, anyone else?
Regionalize the disease and its control, and then the cost of that particular issue, problem.
Okay, see, there is a very fine line. There is a very fine line between public, what we are talking, health economics and pharmacoeconomics. See, when we are talking about health economics, when I'm talking about health economics, keep everything in, like resource allocation, cost effectiveness, healthcare system, health policies, equity access, global health, and pharmacoeconomics. Pharmacoeconomics is a part of health economics. Pharmacoeconomics is a part of health economics, and this is like a subfield. Okay, pharmacoeconomics is like a subfield of the health economics, subfield of the health economics. And in pharmacoeconomics we just work on the cost and value of pharma product. Okay, pharma product, whether that is a device, procedure, or drug, right? Whether that is a device, procedure, or drug, anything it could be, it works on that, and it evaluates the cost and value of the product in specific thing. A specific thing means definitely disease and outcomes, right? How much beneficial it is to the person, to the user, and all, right? It is how much useful it is to the user, right? And then there is behavioral analysis. I mean, in the part of that, the scope of public health is again, the sixth number, that is behavioral analysis. Behavioral analysis is one of the important part, guys. Don't just ignore it. Behavioral analysis is one of the important parts. So this is about studying how patient behaviors, okay, how patient behaviors and you know providers, how the patient behaves like about the medicine, about the healthcare system, and about their own health, about their finances, about their medication compliance. There are multiple things associated with the patient, right? So that comes under the behavioral analysis. And then they also talk about the providers, right? Providers incentives, and then like how the outcomes are coming and how they are utilizing the resources, and how they are actually providing the government resources or supplying the government resources, and what is their mentality about those things, what is their mentality about those things. So that is very, very important in the behavioral analysis. I'll tell that thing later, so I'll come to that a bit. Okay, and then it is global health, very important. How the health economics works is where exactly we need to study the global health is I mean the public health, or the public health economics is global health, right? Global health means, see, let me tell you one important thing about global health. When we are talking about global health, let me write it a big in the big capital letters, global health. So what exactly this is and how it works in the public health economics or pharmacoeconomics also. You must be seeing that the company, the countries, okay guys, countries countries are divided into what? Low income countries, right? Low income countries, middle income countries, middle income countries, okay, and then high income countries. There are another there are another things to observe here. Middle income countries are again low middle income and high middle income. Like it is something above than lower, but lesser than the higher. Okay, lesser than the higher, and high middle income is like above than the little middle and somewhere near to the higher income countries. So there are usually the three categories of the countries. There are three categories of the countries. Why the global health is very important part of health economics says, because we need to allocate the funds worldwide, globally. How and when? See, if you just look at the COVID-19. I'm just giving you the example of COVID-19. This was not just the national crisis, this was global crisis. This was global crisis, right? And every country joined the hands to tackle this. Okay, they send the resources. Like you must have seen that India, all alone, India has sent the resources means the medicines, injections, nurses, diagnostic kits to almost 15 countries. You won't believe, 15 countries. This is one of the and they have distributed the vaccines to 47 countries, guys. India has given the vaccines free of cost or at the low cost subsidiary cost to the 47 countries. Okay, India, because India was one of the biggest manufacturer of the things, and being a big brother, India has given vaccines to Nepal, Burma, Sri Lanka, Seychelles, Maldives. They sent and all the African countries. We sent the vaccines to almost 47 countries. You have to understand these are the very new things, and you should, maybe everyone doesn't know these things, right? So this is called resources, distribution globally and global management. Now, what exactly comes in the mind? It comes to lower middle income countries or low income countries when they do not have such resources, or when they cannot afford such resources. So who comes into the picture? WHO comes into the picture, and they allocate the resources. They get the resources from the high income countries, they get the resources from the main sources, and they distribute into the low income countries, right? That's the global health. And another thing comes in the picture here is IMF. Okay, one more important thing, guys, you have to understand this. You might have you don't have the idea of this IMF. That is, that IMF, what is IMF? The many of you know the name, but how it works, I'll tell you. International monetary funds. Okay, this is a very new topic for you guys, and out of the box topic I'm taking for you, but it's very important. International monitoring funds. Okay, now let me tell you how IMF and WHO works. See, the low income countries, the low income countries or lower middle income countries. Okay, lower middle income countries, they cannot afford the things. They cannot afford the healthcare resources. They cannot afford the healthcare, drugs or whatever things are needed, diagnostic kits or treatment kits or management kits. So what they do is WHO and IMF, they give the funds. IMF is usually thing which gives the funds to lower income countries or low middle countries. Okay, lower middle countries. So IMF is International Monetary Funds, where there are almost, in the IMF right now there are 167 countries which contributes, including India. And you must have heard of recently that IMF, they just don't look into the healthcare part. Okay, they just don't look into the healthcare part, but they just look into the development part of the country also. Okay, they just look into the development part of the country also. So when there is someone in the need, like recently you must have heard of that, some $40 billion were allotted to Pakistan. This was a big news recently. Why I'm telling you? Because this is a trending news. This was a trending news. You must have heard. So that money was given every, like every 3 or 4th year as a debt to Pakistan from IMF, just because this country should not, stop the developmental works, or healthcare related policies should not be impacted. Even India takes from IMF. Even all the developing countries have their part. Developing countries take the funds from IMF as a debt, or as a, resilience with some other things, with transactions with some other things, but they take and they use it, right? So similarly, for the healthcare accesses, healthcare development works, healthcare policy works, IMF provides the funds, and WHO discuss the policies. WHO makes the policies, like for the vaccines and all, they make the policies. Okay, now the interesting work come here. Now the interesting facts come here. This is just the scope of health economics you should know. Okay, and you will be telling, where is the use of health economics? Health economics work everywhere. If you are looking for a good career, as I told you, because we are learning epidemiology and public health, so you must know these things, that these are one of the important thing: pharmacoeconomics, health economics, and in that, health economics, health economic and outcome research, HEOR is there. So we are, going towards that. Now the important things come in the mind. Now the important things come in the mind, that what are the methods, how they do. Okay, how they do, let me take this out, how they do exactly. Okay, how they exactly do. So let me write it here in middle, and let me tell you, health economic methods. Okay, health economics method. Okay, you will be surprised that health economics methods. Now you guys first tell me how you can assess the health economics, guys. How you can assess the health economics, how the health economics to be analyzed and to be addressed is scopes, right? How we can address the scope, and exactly how we can analyze by different methods. How? So the question is, how, what are the methods you will apply? This is the important thing what I wanted to teach you today. So tell me, what are the health economics methods, or pharmacoeconomics methods also, you can use the word in that. So tell me, guys, what are the health economics methods? Yes, people. Now I'm looking for your answers. Yes, health economics methods. See, I'm taking just basics. I'm not going to deeper, because I know this is the basic what many people don't know. This basic also many people don't know. So I'll go slow. I'll not go fast. Today I'll not go to the mathematics or something. Survey. Okay, survey.
National national health programs,
National health programs. Okay.
then insurance, how they claim, the companies, insurance companies can also give some data.
Insurance companies. Okay. Cost analysis. Okay. Yes, guys. Ceiling price. Okay, ceiling price. Okay, something new. Anyone else? See, this is the thing. That's why I have chosen this topic, because being a healthcare professional, you all are healthcare professional here. You don't know how you can use the methods to check the health economics. And do you think that you don't use these things, you don't need these things? Main part of any healthcare system is health economics. The first part is cost, and you are not knowing about it. That's why I thought to include this, because research methodology, the epidemiological studies like case series, case report, clinical trials, that I can take in one day, that you can learn in one day. But the best part here to learn is this. Okay, because you should know all these things. Okay, let me tell you guys, let me tell you this. This is going to be very, very interesting now. Health economics methods, all the health economics methods. But if I ask you some questions, if I ask you some questions before health economics, will it be good to ask? Okay, will it be good to ask? Okay, so yes, it will be very good. So let me write the question here and you have to answer. Okay, question is, the term quality of, no, no, not quality of life. Okay, not quality of life, quality adjusted life year. Quality adjusted life year is what? First this, and what type of economic analysis? Pharmacoeconomic analysis. I know many of you want to know this. Pharmacoeconomic analysis method, it is used. Okay, it is used. Okay, let me give you the options for the second question. First question is, what is quality adjusted life years? And the second question is, which analytical method use quality adjusted life year? First is cost minimization method. Minimization method. Number two is cost benefit analysis. Cost benefit analysis. It is going to be very interesting, I'm telling you guys. Then cost utility analysis. Utility analysis. And then the fourth thing is budget impact analysis. Budget impact analysis. Yes, tell me guys, where do you use these things? You read the question again. I'll just share the question again here for you. So the question here is, quality adjusted life year. What is quality adjusted life year? And which pharmacoeconomic analysis method use quality adjusted life year? Cost minimization, cost benefit, cost utility, or budget impact? Which method uses that? Yes, guys. Cost benefit. Okay. The extension of life expectancy due to the use of medicine for some disease. Okay. Quality adjusted life year measures the value and benefit of the health outcome. Increased life years in lieu of decreased quality of life. Okay. Is measure of how disease treatment lengthen the quality of life. Lengthen and quality of life. Okay. Okay. Is it anything else, guys? You know about quality of life, quality adjusted life years? Yes, tell me. Quality adjusted life years is measure of, okay. Okay. Okay, so many less answers. Let it be. It's okay. I'll go to the question again. I'll come to these health economics methods later. Let me, okay, or first let me tell you about the health economic methods. Then I'll come to that. Okay. So let's see, let's learn these things here. Because that is very, very important. Okay. That is also one of the very important aspect. What are the methods you use, what are the methods we use. So if I'm writing here health economics methods, okay, health, HEALTH, health economic methods. Guys, focus, it is very important and very, I believe it's interesting. Okay. So, guys, you won't believe the first method, very important method is cost analysis method. Okay. Cost analysis method. Cost analysis methods. And in the cost analysis method, exactly there are four types. Okay. There are four types. First is cost minimization. Cost minimization. And cost minimization analysis, we call it CMA, cost minimization analysis. Okay, what cost minimization analysis exactly does? It compares the costs of two or more interventions with equivalent outcomes. What exactly this is? Cost analysis methods, first thing is cost minimization analysis. Cost minimization analysis means, suppose there are two policies implemented to the suppose there are two policies, which are implemented to the public. Okay, two policies for the same thing, like suppose, the central government has, let me take this example only. Central government has launched Ayushman Bharat, where they are giving 5 lakhs per person which is eligible. Okay, and state government has launched another scheme which gives 5 lakhs per person. Okay, but only for some specific relative, I mean specific relatively, lower castes, like suppose SC or ST. Okay, they are giving these to these people only. But Ayushman Bharat, suppose it includes all the population, all the population but who really deserves. Okay, who has no some bar for minimum income, right? Ayushman Bharat policies are different. Different means they are for the actual needy from any caste, any religion. Okay, and state government has launched one policy which are for specific caste. Okay, which are for specific caste or religion, whatever, right? So cost minimization policies or cost minimization analysis or method, what they do is they analyze these all policies, these two or more policies, whatever is, like suppose someone has like the Maharashtra government has launched something else, UP government has launched something else, and Madhya Pradesh government has launched something else, right? All three are BJP states, suppose. I mean giving you the best example here. All three are BJP states and all three have their different policies. All three have different costs. All three are covering different coverage, I mean health coverages. All three are giving different amounts. Okay, looking at the policies, those are different, but when exactly it comes to deliver the outcome, or when it exactly comes to the specific purpose, okay, specific purpose of the outcome, that time actual assessment happen. That time actual assessment happen, like which policy was spending less, which policy was cost, economical cost and delivering most impact to the society. Okay, delivering most impact to the societies, right? So this is at a bigger picture. This is at a bigger picture. Cost analysis policies, cost minimization analysis are being done to analyze these type of policies and to make reports of these policies and make improvements in these policies for the next year or maybe the next 10 years. Okay, that's how the cost minimization analysis policies work. I will come to that. Cost minimization, so they work on like the cost of two policies which actually have, I mean in aspect of impact on the society and expenditures. The second thing is cost effectiveness. Okay, cost effectiveness analysis, that is CEA. Okay, so here they compare the cost per unit of healthcare outcome. Here in cost minimization analysis, we were checking the two policies at a broader level. Guys, understand the difference. It is very important. Okay, cost effectiveness analysis is comparing of two costs per unit of healthcare outcome. Okay, per unit of healthcare outcome. And here we come with what? Here we come with QALY, quality adjusted life year, cost per quality adjusted life year. So here we are checking everything at the unit level, at the individual or small unit level. Okay, and number 3 here is cost utility analysis. I'll tell these things in in detail tomorrow. Okay, cost utility analysis with more examples. Cost utility analysis. So see guys, this is similar to cost effective analysis. CEA and CUA, cost utility analysis, are the same, but it incorporates cost utility analysis, incorporates not only quality adjusted life years, but it incorporates the patient's preferences also. Okay, patient's preferences and actual quality of life. That means you are giving the options to the patient and you are analyzing their preferences. You are analyzing actually the patient preferencing and you are comparing with the actual cost per unit what you are giving in your policy. Okay, or in your things, whatever you are giving, that is compared with the actual patient's preference and actual quality of life. Quality adjusted life years are compared with quality of life here. And then the fourth thing come is cost benefit analysis. Cost benefit analysis. Okay, I'll tell you these things. I hope you are understanding the basics here. So here cost benefit analysis are one of the best part. I'm telling you, are one of the best part, because it takes everything, all costs and benefits, into monetary terms for the comparison. All costs or the benefits, it takes everything into monetary terms and then only compare. Monetary comparisons it does. Okay, cost benefit analysis does into all the monetary funds or the monetary terms. Why I am just we are just talking on the basics of health economic methods. So cost analysis is just one method, and cost analysis also there are four. I just told you in the brief. Then the second part comes is statistical and econometric methods. Okay, statistical methods or econometric methods. Econometric methods. What are these exactly? These are the regression models. Actually, these are the regression models. These are actual statistics regression models used to identify the determinants, what I told you, the determinants, risk factors, and the, if they are working in the prevention diagnostics, whatever the determinants of where we check the determinants by regression models, determinants of healthcare costs, healthcare costs and outcomes. Okay, and not only the regression models but survival analysis also. Okay, like survival analysis to study the time to event data. Okay, to get the time to event data, we usually do the survival analysis like disease progression, survival post treatments, and in that all the big statistical methods like the demand forecasting models also we use. Okay, demand forecasting models, we call them demand forecasting models for the healthcare services. These are usually for the healthcare services, like what is the demand, what is the supply, right? Supply and demand analysis can be done by demand this demand forecasting models, right? So these are very very important to understand. And not only this, I will tell you some more, like there are many methods actually in health economics. There are many methods. Another method is decision analytic model. Decision analytic models. Okay, decision analytic modeling is very very different and very specific. Like why these are important, let me tell you one by one. Suppose there are two methods. Okay guys, focus on this. There are two methods. one is Markov method. This is just I'm giving you the brief, like what type of methods are there. You can, read them, and I will also tell them you in a little more details. Okay, first is, I'm just telling you healthcare economic methods. One is decision analytical models. Markov models are, Markov model are used for the chronic diseases. Okay, chronic diseases, to estimate long term costs. Okay, very simple. Just the name looks like very tough. There is very simple: long term costs and outcomes. Okay, Markov models are used for the chronic diseases to estimate the long term costs and outcomes. Another decision analytic modeling is Monte Carlo, not the T-shirt wala clothing brand. Monte Carlo simulations. Okay, Monte Carlo simulations, and this is the another method for decision analytical modeling. Monte Carlo simulations helps in addressing the uncertainties. Helps in addressing the uncertainties. Uncertainty in healthcare decision making. Healthcare decision making. Okay, healthcare decision making. Uncertainties means there are, if there are any flaws, if there are any mistakes, if how to correct those mistakes and all, that we can check by Monte Carlo simulations method. Okay, so these are three major things what we understand. One is cost effective analysis, statistical methods, and decision making. So decision making is by models. If we want to make a decision on the long term cost and outcomes, we can use Markov models. If you want to check uncertainties in the healthcare decision making, that we can do by Monte Carlo simulations. But this is not only stopped here. Okay, these methods, healthcare economical methods, are not just limited to this. There are many other things. There are many other things. Okay, like if we talk about one more thing, which is HTA, health technology assessment. There are equity analysis. There are behavioral economics. Okay, behavioral economics, that I'll tell you. And there are policy evaluations. Okay, policy evaluations, right? So these are something which we have to learn in tomorrow's class. Okay, we have to learn in tomorrow's class these Markov methods and all. I was telling you the cost minimization analysis. There are four things, and there are specific steps like identifying the interventions, how to measure the cost, how to compare the cost, how to do the sensitivity analysis, and where is the exact application of that, and what are the limitations of these things, and with examples. I'll tell these things, guys, tomorrow, because today I have another class from 8 p.m. So this tomorrow I'll take, and continuously 4 days I'll take your classes, guys. Don't worry. Okay, one extra day I'll take for your uh, course. So till Thursday, I will take your classes every day from 7 to 8:30. Okay, don't worry. Today a limited class, but by tomorrow I'll be taking the full-fledged 1.5 hour class and proper class on these things. And tomorrow I will be explaining this further next, and with another big examples, and I'll be explaining these things in detail. Okay, so you can easily understand this part. You can easily understand these analysis models, cost effectiveness models, and cost benefit ratios, cost benefit analysis and all. You can do that. Okay, if you want to study a little bit in advance by yourself, you can do that. And I will also tell you about quality of adjusted life years, and the what is the exact difference between quality of life and quality of adjusted life years. I'll tell that also tomorrow in tomorrow's class, guys. Okay, so I hope you got a little glimpse of the health economics, guys. Any questions? I believe I'll take the questions tomorrow in tomorrow's class. Okay, because tomorrow you will have a broad picture of these things, and you will have some more good picture of these things, and tomorrow you will understand understand these things better. No feedback form, guys. Tomorrow is just a free class for you. You don't have to worry about today's attendance. Don't worry. Okay. Okay, guys. So thank you very much. Tomorrow Please come up with the questions tomorrow. Please come up with the questions. I'll take all the questions tomorrow, okay, related to this, because tomorrow I'll finish this topic. Thank you guys, thank you very much, thank you.